National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. Do you suffer from recurrent bladder pain, lots of lower pelvic pain, urinary frequency, or difficulty with urination? If you do, you may suffer from a condition we call interstitial cystitis. Essentially what this is it's inflammation of the lining of the bladder wall. It's a chronic inflammatory condition. It's poorly understood. We don't really have a specific diagnosed cause. In my practice, I often treat it as a symptom of an autoimmune condition, and I've had quite a bit of success in doing this. One of the key features we find in people with interstitial cystitis is an upregulation of their immune responses in their bladder. Basically, their bladder overreacts to a variety of different stimuli. This creates an increased inflammatory response and can even result in special types of ulcers within the bladder called Hunner's ulcers. So about 10 to 15% of people with interstitial cystitis actually have inflammation to the point where their bladder is ulcerating or creating these large lesions. So as you can imagine, it's a very painful condition. A lot of the times the urinary frequency comes from the fact that the urinary bladder can't expand the way it normally does. Think of it as, if it's damaged, if it's inflamed, and you're trying to stretch an inflamed muscle. The bladder itself is a big muscle. And so if you're trying to stretch this inflamed muscle that has ulcers, you can imagine that's not comfortable. So the body's compensation is frequently urinate to prevent the bladder from stretching at all. So in people that have this condition, there's a number of things we can do to try and limit the inflammation within the bladder lining to make them more comfortable. One of the things I often recommend to these patients is N-acetylglucosamine. And the reason for this is this type of glucosamine is really effective at improving your body's the elasticity of tissues. It's needed for the formation of connective tissue. And so this type of glucosamine really targeted especially towards soft tissues, things like muscles. So when you're trying to repair muscles, using an N-acetylglucosamine targets muscular tissue a little bit better than it does joints like other types of glucosamine do. That's why I really like to use N-acetylglucosamine in these patients. I'll also typically use anti-inflammatory enzymes. The reason is these enzymes are systemic and they will reduce inflammation in the bladder lining. So I'll typically supplement somebody with serratia peptase as I find it very effective. I also look at boosting these people's immune system because as you can imagine, if you've got things like chronic inflammation of the bladder, if you've got ulcers, you can actually be more susceptible to urinary tract infections as well. So making sure the immune system is working well will help reduce the risk of urinary tract infections that go with interstitial cystitis. So things like zinc, vitamin D, and vitamin A I found very effective at reducing urinary tract infection risk, and in many cases that actually also helps to reduce the symptoms of interstitial cystitis. So if you suffer from interstitial cystitis or you suspect you do, go to your doctor, ask to be tested for it. They can actually do a biopsy and determine if you do have this condition. And if you do, consider some of the therapies I spoke about today to help minimize your symptoms and live a more comfortable life. So if you like this video, check out more of the videos on our channel, subscribe, and if you have any questions or comments, post them below. And always remember, knowledge is health.